and we'll get started.
Yeah. Hey y'all, happy Friday. Thanks for joining us. It's rainy in Spartanburg today. I hope it's prettier where you are. But if not, I hope you have a great Friday no matter what. We're excited to have Danna here from American Lung Association joining us. And then we're also going to have a national partners update, also from Danna, Andrew Wylam from the American Heart Association, and Beth Johnson from American Cancer Society Cancer Action Network. So thanks for those three speakers joining us today. I'm not going to keep us long. I'm just going to hand it over to Danna and let her start our presentation.
I always get caught up with Zoom because I'm used to Teams. So give me 1 second. Okay, can everybody see?
We can.
Yeah?
Yeah.
Okay, great. Hi, thank you for having me. Danna Thompson, Advocacy Director for the American Lung Association. I cover Georgia, North Carolina, and South Carolina. I'm going to be covering our State of Tobacco Control report today that was released this January. This report evaluates states and the federal government's actions to eliminate the nation's leading cause of preventable death, which is tobacco use. The report really provides a blueprint for states and the federal government to follow in order to prevent and reduce tobacco use. As probably most of you are aware, 2025 was really a devastating year for tobacco prevention and control policies. The federal government eliminated the Centers for Disease Control, FDA, Center for Tobacco Products, and these actions truly weaken enforcement and risk reversing years of declining tobacco use. So, I just, if you're not familiar with this report, it really does set a high bar. Sorry, I didn't know if that was a comment. This report really sets a high bar. So, these actions by the federal government weaken tobacco control policies. We advocate for strong tobacco control policies and funding, and overall, want to set the landscape. So some of the themes, as I mentioned, are the changes to the federal landscape, which has kind of shifted on us a few times now. Some of the other topics of the report are the staffing reductions and the authorization of new products. We are really calling on states to fill this void from the lack of federal leadership. Just to touch on goals from the report, we want to use this report to advance policy change at the federal, state, and local level. We, hope that it will generate media attention. We did, I kind of called out here, we got some coverage in the Daily Gazette. And we want to reinforce our position on proven evidence-based tobacco prevention and control policies. So the grades for South Carolina. Unfortunately, South Carolina continues to lag behind much of the country in policy efforts to prevent and reduce tobacco use. These grades really emphasize that the state must step up efforts to reduce tobacco use and protect communities, especially with the uncertainty and rollbacks we've seen on the federal level. I always want to emphasize that this report and these grades are meant to reflect policies and actions by policymakers or lack thereof. It is not a grade for those working in the tobacco control community. So health-related costs in South Carolina are nearly $2 billion a year. And tobacco control lobbyists in South Carolina have more than doubled since 2023. So 2023, it was documented that there were 12, and 2025 we're at 27. So we're really, up against a huge lobby in the tobacco, big tobacco community. They continue to deploy a vast and well-funded lobbying machine to protect its profits and delay life-saving public health progress. Nationally, total registrations in 2025 showed a 24% increase from 2024. So despite the state receiving nearly $2 million in tobacco-related revenue, South Carolina only funded tobacco prevention and control at 17% of the CDC recommended level based on population. And that number is probably a little bit lower based on information we've learned recently. I probably don't have to tell you all that funding tobacco control programs can and do counter the billions of dollars in predatory marketing the tobacco industry deploys each year. In addition, not only does the money provide for programs and services, which in turn help kids, prevent and stop them from starting and help people quit tobacco use, it also sustains and increases reductions in smoking from other policy initiatives. Tobacco control programs also play a critical role in helping to address tobacco-caused health disparities. So, tobacco tax. It's one of the most predictable sources of revenue that states can receive. And any significant reductions to state tobacco tax revenues from ongoing smoking declines are dwarfed by the much larger reductions in overall smoking-related costs. South Carolina has one of the lowest cigarette taxes in the nation, ranking 4th lowest at 57 cents per pack of 20. It's significantly below the national average, and it has remained unchanged for over a decade. It's been documented on numerous occasions that tobacco companies have publicly admitted the effectiveness of tax increases to deter smoking in their filings. Indiana is a recent success story. The legislature raised it, I think this last summer, to almost $3 per pack and equalized it for e-cigarettes and other tobacco products. So in the first 3 months, they saw a 40% reduction in cigarette consumption, and enrollment in their state cessation program jumped almost 40% at that same time. Not to mention that they also brought in nearly 3 times the revenue from cigarette taxes as they did the same time of the previous year. So South Carolina does not have a comprehensive statewide smoke-free air law for workplaces, restaurants, and bars. It ranks among the states with the most minimal public smoking restrictions. So therefore, the F grade. It is, prohibited in specific areas like government buildings and schools, but more than half of South Carolina residents lack protection from secondhand smoke in indoor public places. So South Carolina is one of the few southeastern states with a B grade. So that's great news in the report. This grade really tells you how well the state is doing in providing access to medications and counseling to help people who use tobacco quit. Flavored tobacco products is new to this report. And it's probably not news to you all that flavored tobacco products have long played a really important role in youth starting tobacco use. In 2024, about 88% of high school and middle school students who vaped use flavored e-cigarettes. Tobacco companies have for sure focused their marketing on menthol cigarettes on certain populations and particularly Black communities. There are 7 states to date that have enacted restrictions on flavored tobacco products or e-cigarette products to curb youth use. These range from comprehensive bans on all flavored products to specific restrictions on flavored e-cigarettes. So kind of in summary, what we do with the report is try to focus on 3 state policy goals. And this year, we do have an ask along with partners for increased funding to tobacco prevention and control. We are calling on the cigarette tax to be raised by $1, really probably $1.50 per pack or more, and to be equalized with other tobacco products, and strengthening or enacting really tobacco retail licensing laws. If you're interested in receiving alerts or staying in the know, please feel free to follow this QR code. And I really appreciate you all listening in today, and happy to answer any questions.
Danna, if you're able to share that action alert, either an email or the chat, I can send it out after the meeting as well.
Yeah, thank you. I will do that.
I pulled out my phone, but I wasn't quick enough.
Oh, sorry about that.
No, you're fine.
So I think I'm going to throw it to Beth and Andrew for legislative updates.
I have a question for Danna.
Yes.
Yeah, what's going on in Georgia and North Carolina? It seems like to get anything going with, price effects here in South Carolina, they always are worried about the border and people, if it's cheaper in Georgia and North Carolina, then people are going to cross the border and buy their products. What's going on with Georgia and North Carolina?
Yeah, unfortunately, it's not better news. Georgia was called out as one of four states with the most need to enact stronger tobacco control policies. Tobacco tax has been really a buzzword in both of those states and around the Southeast, with the uncertainty, during these, budget federal cuts and whatnot. And I know in Georgia, with them trying to cut, income taxes and property taxes, they're really looking for new revenue sources. Unfortunately, we haven't seen any specific legislation to increase it. There is a bill in Georgia that's been dropped the past few years, but it's really a nominal increase to tobacco taxes. But you're certainly correct in saying that, states are always kind of looking around the borders to see, what their neighbors are doing, and that does have an impact.
Any insights on North Carolina? I know you're located in Georgia.
Yes, in North Carolina, partners are talking about, for the first time in my tenure at the Lung Association, we are talking about advocating for increased tobacco taxes. So that's some great news, and we'll see what happens this short session, because, it's the same story really in North Carolina, that they're looking for, revenue generation any way they can. So we'll see. The short session will start in April. So we have, been in talks about tobacco tax there as well.
All right, is there any talk like between heart and lung and cancer about getting a 3-state kind of work group going to work on the tax? South Carolina, we don't really have anything for vape liquids that I know of.
No.
And I think there's been some talk with this heated tobacco law, that there's some legislation, and I know in committee that it was brought up about starting to tax the vape products in committee, but I don't have an update. Maybe Beth or Andrew might have some more information on that.
Yeah, and Dr. Keeley, I will say that, over the years, we've all kind of, at the national partner level, we've all kind of talked about, can we do this as a joint effort? Can we look at a lot of the southern states and kind of partner together? And really what we kind of keep coming back to is that each state is so very different that it almost has to be a state by state. Like, sure, we can say North Carolina does it this way, Georgia does it this way, but for the campaign and for really the strategy behind the campaign, every state is so different in the way the laws are written and the way that we'd have to put things in code. So I don't know. It sounds good, and I would really like to have all of our states kind of work together, but I don't know that I don't know that it would be a realistic campaign.
Because isn't that what we did back in 2000 to 2010, we had, what's it, TFK sent
Yeah.
us somebody to
Yeah.
coordinate.
Yeah. I think they sent Anjul Smith to South Carolina, and she helped to coordinate a lot of the efforts. Um, but I don't know. I don't know that that would be something that we could certainly take back and ask. I don't know that it would be right now, and kind of especially
Yeah.
with all the different products
Yeah.
and the lack of parity among the products. I don't know that it would work. I mean, we had Senator Hutto make a suggestion to add a tax to vapes, and he wanted to use the example in North Carolina. It was not a great example. We would not want that. We wouldn't support that. But he looked to North Carolina because they have a very minimal tax. And he wanted to try to do the same in South Carolina. So it sounds good. It would work, but I don't think it's going to work.
Yeah. Okay. Well,
Yeah.
it's good to hear,
Yeah.
what's really out there, and
Yeah.
that's what the roundtable's about. Yeah.
That's right. Yes. Well, I can thank you, Dana, for that. I don't know, Tara, do you want me to I can start talking about the funding issue that we're working on, and then pass it to Andrew to talk some about heated tobacco, and we can kind of both tackle these issues at the State House.
Yeah, that sounds great.
Okay. It's interesting because every year I'm like, maybe it'll be a quiet year for tobacco. No, it's so not a quiet year for tobacco. One of the first things that we saw out of the gate, it was the registry bill, the tobacco vape registry bill, we're calling it that. But that was a bill that was introduced last year, and it kind of sailed through pretty quickly, and it is now waiting for the governor to make a decision on. I'm going to see if I can't put an image in the chat box that you all may find interesting. And I'll try to do that in a minute. But the Vaping Technology Associates are out in full force. And as you heard Dana say, we have now more tobacco lobbyists than ever before roaming the halls and the State House. But they are asking the governor to veto the registry bill. What has come across as it started coming across as this is a bill to help do something to be able to register who sells the products, the tobacco products in our state. It really doesn't do much. And so the registry bill is it's a tobacco industry bill. It was brought forth by the industry to make legislators feel as if they're doing something. So I'll try to find that. Well, I found the graphic. I'll see if I can figure out how to put it in the chat. But that's the first piece of legislation this year that we saw pass both chambers and kind of make its way to the governor's desk. The other piece that we're working on is tobacco prevention and control funding. And again, as Dana referenced in her report, the state of South Carolina receives $5 million annually from the revenue generated from the cigarette tax. And that $5 million goes to the Department of Public Health for tobacco prevention and control efforts. And then they disperse that and use that for different programs and some in the community. There's another $5 million that's generated from the tobacco revenue that goes to Hoggins Cancer Center down in Charleston in USC for tobacco research. What we continuously know, we're looking at what impacts the reduction of use for tobacco for both youth and adults is programs and services that help adults quit and help prevent youth from ever starting. So our goal every year is to recruit and receive more funding for prevention and control programs. And so that is our ask of the General Assembly this year. We are specifically asking for the funds that have been received by the state of South Carolina through the Jewel lawsuit for that funding, that pot of money that for the past 2, 3, maybe actually 3 years, that has gone to the Attorney General's office, and then it's just kind of trickled into the general fund. We are asking specifically for that money to go to tobacco prevention and control efforts. This year, the state of South Carolina will receive about $1.7 million in that settlement, that lawsuit. Now, in the lawsuit, it does not specify that the funding has to be used for tobacco prevention and control. However, that's sort of the implied use of the money, but it doesn't say that it has to be. And so that money has just been kind of shifting into the general fund and being used for whatever for the general funds. So our ask this year specifically has been for that money to go to the Department of Public Health for prevention and control efforts. And we are hoping to even specify that down a little bit more so that we can we can help direct that money. Our preference is directly back into the community. So we would love to be able to give groups around the state that we know are on the ground doing the work that money that, we don't want to just sit there. We want it to be used and pushed out into the community. So that's our big ask right now for prevention and control funding. I think we are encouraged that there is a proviso in the first version of the House budget. So if you are in the Orangeburg area, you can thank Representative Gilda Cobb Hunter for making a push and adding a proviso to the first version of the budget. We call it H1. And it's asking for the JOL funding to go to prevention and control efforts. So that is a good first step. We have several more steps in the process. It has to make it through House version 2, and then it has to make it into the Senate version as well, and then back over to the House. So we're just starting the process. There's several more steps, but I think the conversation can be, as you are, around the state talking to legislators, is that it is important for us to have that tobacco prevention and control funding, and that JOL funding money, the JOL money from the lawsuit, is just an easy pot of money that we need to use for truly what it was intended for. Again, it's not in law written that it has to be used for that, but that's obviously the intent. So I'll see if anyone has questions about the funding ask, and then we can try to tackle the heated tobacco discussion. Yeah, Dr. Keeley.
Yeah, could you comment also on the 1998 master settlement money and anything that's going on with that? I think my understanding is that the legislature just throws it all into Medicaid, but is any of that going into prevention?
Yeah, so the majority of that money goes to support Medicaid, and it goes through DHHS. To my knowledge, none of that tobacco master settlement money, none of those dollars go to support tobacco prevention and control efforts. It's all going toward Medicaid and then toward the general fund, and then to just support DHHS as a whole. And that's been something that we have looked at and tried to ask about for years. In fact, we started, instead of calling it, I think at one point we were calling it the MSA funds, we started throwing in an extra syllable, and we're like, it's the tobacco master settlement funds, just to put an emphasis on where the money came from. And it's going all to support Medicaid.
Yeah, I mean, even if they just said smokers who are on Medicaid, they're going to help them quit. I mean, let's at least do that.
Right.
If we're going to do Medicaid, then specify that it goes to, fund efforts to help Medicaid insured people who are continuing to smoke to quit.
Yeah.
I mean, my gosh,
Just such an important point, Dr. Healy, because Medicaid and the uninsured smoke at twice the rate of those that are insured, so it is really an important point.
Yeah. I think kind of along those same lines, Dr. Keeley, it's been interesting as we've talked about the heated tobacco conversation, and we've had some formal and informal conversations with members of the Senate. They've been talking about the data on the tobacco tax, and specifically one senator pointed out that we want people to quit smoking, and we should expect to receive less revenue that's going to be generated as we encourage people to quit smoking, and how that's going to impact things. And I think he really heard that from the South Carolina Hospital Association. They made a comment in their budget this year in the House about how smoking rates are slowly declining, and that could impact the revenue generated. And so that's been sort of an interesting side conversation where they haven't really gone in and said, okay, well, we could fix this by increasing the tax. They've kind of danced around it a little bit, but it's interesting that it's the first time that I've heard that conversation from someone, not us, not the tobacco, partners, but from the hospital association.
Wow. Okay, that's a interesting thread to follow up.
It kind of is, yeah.
Yeah.
And I'm not really sure what their intent was in going there exactly. But it's been interesting to see what's going on.
Well, my representative to the House, Heath Sessions, is
Yeah,
the medical affairs chairs the subcommittee, I think. So
right. That's
if
right.
there's anything
Mhm.
you want me to bend Heath's ear about, I'm there.
Okay. Well, there's some things I think we can do as it relates to prevention and control funding, and just making sure that they're aware of this Joel Settlement Fund and how that could easily go into prevention and control. And I think certainly the conversation around tobacco tax needs to happen now. The Board of Economic Advisors, who are the folks that tell the Senate and the House how much money they can spend in the budget and how much money they're projecting the state to have, they are slowly starting to say that South Carolina, the surplus that we've had in the state, that South Carolina's surplus is slowly dwindling. And I think that's going to come into play, especially as we continue to have conversations about Medicaid expansion and, what's next and how do we fund projects at home that the legislators like to do. So it could be a really good window of opportunity for us to have that conversation about a tax increase, next year. This year is an election year for every member of the
Right.
House. Nobody wants to talk about increasing taxes. They all want to, like in Georgia, they want to decrease all the taxes. So, but it's a good time for us to start thinking and planning now.
Yeah.
Beth,
All
do you
right.
want me to share in the chat information about the Suits and Sneakers event next week if anyone would be
Yeah,
interested in
sure.
attending that?
Yeah, sure. That would be great. ACS CAN's hosting a lobby day next Wednesday at the State House. We'd love to have you guys attend if you're interested. One of our asks will be tobacco prevention and control efforts, and potentially talking about stopping a bad heated tobacco bill. So, Andrew, tell us what you know, and I'm happy to fill in.
Sure. Well, good morning, everyone. I'm Andrew Wylam. I'm the South Carolina Government Relations Director for the American Heart Association. Thanks for having me on this morning to talk about the heated tobacco bill. So, where to begin with this? Last year, this bill was introduced in the House, and what the bill would effectively do is it would provide an advantage tax rate for a new type of tobacco product, which is called a heated tobacco product or a heat not burn product. And what's different about these products from cigarettes is they're kind of like a higher technology device where you have a cartridge that goes into a heating chamber and it heats the tobacco leaf, and that produces kind of an aerosol or a vapor that delivers nicotine from the tobacco leaf to the user. And so there's the argument for the tobacco industry is using for why these should be taxed differently is because when you burn the tobacco leaf, you're inhaling a lot of chemicals and other chemical byproducts from the tobacco leaf that has carcinogens and a whole bunch of just really harmful chemicals. And when you heat the tobacco leaf to release the nicotine without burning it, it doesn't release a lot of those chemicals. However, research has found that there are still some harmful constituents that are released, and there are also harmful chemicals that are released that are actually not released in combustible cigarettes. So it's a different kind of risk, but these products are being sold to our lawmakers as if they are tobacco cessation aids, and they're going to help people stop smoking. They're going to be less harmful, less risky for the users if they use these products. So back to the House. We fought against this pretty hard last year in the House. We testified in committee. We were across the table, basically, from the tobacco industry having this conversation. And what it comes down to is There's a little bit of a confusion right now, actually, about how these products are currently taxed, if they're taxed as cigarettes or if they're not taxed at all. Beth and I and Dana, we're all trying to kind of figure out the answer to that question from the relevant agencies, because there's been some conflicting information from the Fiscal Affairs Office and the Department of Revenue. So we're trying to get to the bottom of that. But basically, this bill would create a new line on the cigarette tax that would be at somewhere around, in total, half of what the tax is on a pack of cigarettes. But what's interesting about our tax code in South Carolina is that we actually have two different taxes on cigarettes. There's the baseline tax, and then there's the surtax. And the surtax is an additional 50 cents that's levied on each pack of cigarettes. And that is, like Beth mentioned earlier, that funding goes to Medicaid, it goes to cancer research, it goes to prevention programs at DPH. But what they would do by creating this new tax is it creates that tax on the first part of the tax. It doesn't actually have that second surtax apply to these products. And so if there were to be a lot of people that switch to these products, they would pay a lower tax rate, and B, it would siphon off money from those important tobacco initiatives that our state runs. So ultimately, the bill last year, it passed the House, and it was carried over to 2026. It didn't pass the Senate by the end of 2025, but because we're in a 2-year session, the bill is still alive. And so it was scheduled for an initial hearing earlier this month in a Senate Finance Subcommittee. And Beth and I went again to testify against this bill. And some interesting things happened during that committee hearing. I think we had some pretty good arguments about this that the senators were receptive to. I think it was particularly effective because the tobacco industry lobbyists came out the gate and said these are cessation products. And our first talking point is that they're not. And so there was some discussion among the members. We had some good questions asked of us by the members. But ultimately what happened is Senator Hutto, who's the Senate Minority Leader, he had offered an amendment to this bill. And the amendment would impose a new tax on vape products. Because what the tobacco industry is trying to do here is they're trying to sell this idea of risk-based taxation, where the amount that we tax a product, it should be commensurate with how risky it is for the user or how harmful it is. And we strongly disagree with that, though. We feel that parity between all tobacco products is the best way to get people to stop using them. Because if people know there's a cheaper alternative, they're going to go use that. And so Senator Hutto basically made the point, well, if we're going to do a risk-based taxation, then why aren't we taxing vape products at all? Because those still carry their own health risks. So the amendment was not adopted, but they are going to take some time to discuss it among themselves. And they carried the bill over, so it hasn't moved yet. They're going to schedule another subcommittee hearing in the next couple of weeks, we anticipate. So we are going to spend some time talking to those members and continue to educate them and share our concerns with them. But it does look like Senator Hutto's amendment is going to be considered, and they want to call in DHHS. They might be talking to the Department of Revenue to get more information about how the agencies would look at this, because I think that HHS in particular might be experiencing a little bit of a funding loss due to the smoking rates changing. And I think he wants to know, what would it take to make up for that loss with a new tax on vape products? And so all great conversations, but, this is ultimately, I think, something we wouldn't, at the end of the day, support, because it's not parity between products with how they're taxed. But our goal really with trying to interfere with this whole process is just to slow this bill down and hopefully kill it, because we don't want it to get enacted. So that's where we're at today. Again, there's going to be another hearing in the near future. We'll probably be there again to testify, and we'll keep y'all updated with how that goes. But that's where we're at with the heated tobacco bill.
Are there any other champions for what Senator Hutto has put forth?
It was kind of unclear based on the hearing. I think that the other senators on the committee were receptive to what he was saying, but I think that there were details that they need to figure out about what the right tax would be on the vape products before they would adopt the bill or the amendment. So I think that they're having some conversations behind the scenes to figure out really what that looks like. But there wasn't anyone who came out and said, "Oh, that's a bad idea. Let's not do that." It's more just like, let's talk about that some more.
Okay.
I think what we clearly saw were, as Andrew and I exited the subcommittee room, we saw the Vaping Technology Associates lobbyist and the tobacco lobbyist all scrambling and saying, "What the heck just happened?" Because now they are, potentially looking at attacks on their product, which they don't want. So, kind of what we saw with the registry bill is some kind of infighting among the tobacco industry, big tobacco, and the small businesses with vaping. And honestly, that does us good with this bill as well. So let them have at it, like go for it, and they can fight it out. I put a good I think it was a really good opinion piece in the chat box from Cindy Ross-Scoppy, who has a longstanding relationship at the State House and has been just a great editorial piece that she did. So I put that in there. She is really an investigative reporter, and so she does this good work in trying to get to the bottom of things. And she is actually the one who was able to get a response back from the Department of Revenue on how they view the heated tobacco product, which is most likely, most commonly in South Carolina. It was last sold in 2022. It was IQOS was the product. There are a couple of others on the market, but that's the one that really has the name recognition.
Beth, I had a quick question about the vape registry bill. What is the specific difference between that and the tobacco retailer registry? Is there any difference or?
Yes. Yep.
Okay.
Yep.
Yeah.
Yeah, I'm going to pass that to Andrew because Hart's been working in a few other states on the tobacco registry, the retail licensing bill.
Not well equipped to answer that question right now.
Okay.
But I can say that as a framework, the vape registry is it's
Do nothing.
It's a do nothing. It's ineffective. I think at the end of the day, the senators they want to do something. They notice in their communities that vaping among the youth is just like a really big problem. They hate it. They hate being around it. They hate seeing it. And they want to do something to curb that use. And so, they're very activated about it. And they want to look at solutions, but the solution on the table, it's just not going to change much. I mean, they want the manufacturers to register their products with the Attorney General as a condition of selling them and to pay some minimal fee to do so. And, the difference between that and like a tobacco retail licensure is, there's not much of an enforcement mechanism beyond just registering with the registry. They're not going into the retail establishments to do inspections to say, are you selling these products? Do we find products on your shelf that shouldn't be sold? And beyond that, there's still vape products out there. Youth are still going to have access to these products. This does not change anything about how they're accessing these products, whether or not they're being properly carded when they try to buy these products, whether or not these vape shops are really carding at all. Those are, I think, the real pain points with how this is happening so frequently in our communities. And this bill just doesn't address those problems.
Yeah, and
So
I'll add to, when the tobacco industry is offering a solution, people should ask questions, and that's where these are coming from. So we always have to recognize that.
No, I totally agree. I guess what I was saying is that we have a tobacco retailer license, that this tends to talk more to product registration.
Mhm.
Is that
Yes.
really the big difference? Okay.
And so I think when you look at it in the big picture, like from the tobacco industry's perspective, they are competing with vape products.
Yeah.
That is their main competitor. And when they can get a lot of those products off the market and create barriers to them getting sold or extra layers of compliance they have to do to get their products sold, they win,
Okay. Yeah.
because they have fewer competitors.
Okay. Thank you, Andrew.
Yeah.
Dr. Keeley, I think, has a question.
Yeah, the big E word is what I was going to bring up, Andrew. If we can't tax, and indeed in York County, I mean, it's the wild, wild west for kids under 21 accessing, nicotine products. what about enforcement? Who's going to, go to bat funding more, enforcement? And is that a bad thing for legislators to talk about in an election year?
So my take on that, and I've only worked on this a little bit, is that what we would prefer as a framework for how this should happen is that the tobacco retailers should have to apply for a license, and those licensing fees would go towards an agency, and that agency would be responsible for completing periodic compliance checks on those retailers. And so we don't have that really in South Carolina, to my understanding. The problem with lawmakers with why that's bad to talk about is because it would be basically creating a new agency, or it's expanding government or creating more bureaucracy. And in South Carolina, we know that's not a great thing that they like to talk about. So I think that's the real hurdle. And I think that, when I initially testified this and came to the Senate committee before it got passed, like that's really one of my main talking points, and I got basically attacked for even suggesting it, and that's really what it came down to.
Yeah, we just need to find a very angry parent who will go down there to their legislator and start complaining about it. Because I remember when I worked for LLR, tanning beds. That was how they got regulation, was the fact that a couple of parents went down there and said, my teenager went down there and got, burned and all this stuff. And it became a big deal. So that's really what we need. I mean, and Tara and Spartanburg can tell you about the vape store there, where there was a man killed inside the vape store, and the participants in the shooting were 15 and 17. Right, Tara?
Yeah, correct.
And there
I
had been a
think it happened
stabbing.
because they wanted him to buy products for them, is what the rumor mill said.
Yeah.
Is anybody tracking the FDA funding
Yeah.
for inspections? And, how has that been affected by the federal government cutbacks? And, because the FDA, if they cite, that goes on the business owner, and possible loss of business license. Where are we with funding for FDA inspectors?
So kind of twofold for that question, Dr. Keeley. The Department of Drug and Alcohol, Other Substance Abuse, DAODAS, they are the ones that manage those, local inspections and going in and doing the compliance checks. And there has been some kind of controversy back and forth over the past few years about how they're doing those, what age individual they're using to do those compliance checks, because of the federal law being 21, state law they say has to be changed. So there's some back and forth. And then, of course, there was the concern that if South Carolina does not have accurate compliance checks and is not meeting the guidelines and the standards, that we could potentially lose some of those federal dollars. However, DAODAS is really not concerned about that at all. And I don't think there's anyone that is enforcing any part of those compliance checks. Yeah, that's the best way that I can explain it. It's not happening. It's not being enforced. Now I will say, on the flip side of the federal funding, good news is we have heard that there will be additional state funding from the federal government. And so it is my understanding that our Department of Public Health will be applying for that additional federal dollars to come into South Carolina. We didn't know if we would have those dollars that would come into the state or not, or would be able to apply for them. But it is my understanding that the state is going to apply if they haven't already. And we should expect some federal dollars to come into the state.
Well, I know you can go to the FDA website and you can see where they've made inspections. And my understanding was that it's a different level of inspection that the FDA does, where the law supports them finding and creating havoc for the business owner rather than the clerk. Is that not right?
Yes, yeah. I mean, they really tried to put some restrictions to make sure the clerk was not the one that was receiving the penalties, but that it was the business and the owner. And I don't know. several years ago now, a few years ago now, when we were working on preemption, we were able to pull those reports from the FDA, showing where they did the compliance checks and how many. I'm not sure what you call it, but in which counties they had, negative results. They had like not good checks, and they had what's the word I'm looking for? Help me out.
Citation.
Thank you. Yes. Yeah. Yeah. I haven't looked at that in a few years, but it was really interesting to see then. And so that was our argument during the preemption, is that we really needed to allow local towns and cities to have that control and have that authority. Of course, we didn't win that one, but
Maybe that's a topic for a future roundtable, invite
yeah.
the FDA person and get some clarification
Yeah.
and, that would be an interesting learning experience for all of us.
And along with that person, I'd say on that same roundtable, it'd be great to have someone from DAODAS explain how they're working the compliance checks.
Yeah.
That'd be great. That'd be good. I know that they're doing some. I know they're doing some, but there's probably some more we can do.
Yeah, we have some going on in York County, but they're mainly doing alcohol. And then they, when they can, they check on tobacco. So that's kind of what's going on in the ground here in York County.
When I go out to their website, I do see that they were doing inspections in South Carolina in January. So
Great, good.
it says it's tobacco compliance check. So,
Hey,
but
Beth.
yeah, that's a great idea. We will definitely. Sarah.
I'm Sarah Bowler. I actually work for DAODAS, the Office of Substance Use Services. So we would be more than willing to talk about what compliance checks efforts we're doing in the state right now. We have them in every county, and we're about to start the SINAR study. So we would definitely be open to talking about that in the future.
All right, Sarah, we will get in touch with you. Thank you for jumping up. All right. Any other questions? Well, thank you, Danna and Beth and Andrew, for coming on and giving us an update on what's going on in our state. And we really, really appreciate it. We got a couple of things I wanted to bring up to remind everybody that next month's roundtable is going to have Matthew Stone from the University of California at San Diego, and he's going to talk about driving quit assessments. And I saw his presentation earlier. It's a really good one. And then quick save the date, May 20th will be our summit, and it'll be in Columbia at Columbia College. And our theme this year is shaping South Carolina's next chapter in tobacco prevention. So we would look forward to seeing all of y'all there too. And does anybody have anything they'd like to share to the group about what's going on at their organization?
Hey Tara, could you get that ad?
Yeah.
Just for kicks. Let me show you this ad.
I couldn't get it to upload, but I'll share my screen and show you that way.
This is an ad that the Vaping Technology Associates sent around to a political publication in the state that some people subscribe to. And this is in response to the vape registry. Yeah, I like it. SafeFlavoredVapes.com.
Yeah.
Yeah. That's your Friday morning laugh.
Yep. There's so many.
But then you want to cry sometimes afterwards.
Yeah.
That's true. That's true.
We can laugh now and then,
Why are we doing this? Yeah.
Well, I'll speak up. We're excited here in York County. We'd love for people to go to our website and follow us on social media, Instagram and Facebook. It's TFYCC. And our website is tobaccofreeyc.org. We have a parents corner. We have blogs about pouches and mentoring, continue to put up new stuff. And we're going to be participating in a big 3-county campaign. York, Chester, and Lancaster, predominantly York we're focused, but in all the high schools for prom season. And the emphasis of the campaign is, of course, impaired driving, distracted driving, substance use of various kinds. But we're going to add nicotine this year and use it to make kids aware of what the nicotine situation is that they need to know about. And so we'll be featured on assemblies and all the high schools, and we'll also be having a bunch of paid media through our local OTS media outlet here in the 3-county area. So but come visit our stuff and give us some feedback, like us, and we're really continuing to work on the zoning ordinance. I've got meetings with the zoning and planning board and York County government coming up here shortly, and then the working session with the City of York's City Council. So we're moving ahead with that and tying the nicotine message for kids and parents to let's support slowing down the influx of these vape outlets. We've tracked through the DOR web resource, and we had 40 new vape registration tobacco retailer outlets in York County in 2025. So we're using those numbers, and they've increased. Like in 2024 it was like 20 something, and so in 2025 we had 40 new registrations. So we're using that to push our zoning message to change the potential for new vape and tobacco, nicotine selling outlets within distance of schools and parks, and in lower income density areas where tobacco smoking is a higher prevalence. And that really had good support from Smoke Free SC, which we appreciate. Yeah. And also from Art for what we're doing. So thank you.
Happy to help. Happy to help. Tara, did you have anything you wanted to say before we sign off?
I also just wanted to say we also share Dr. Keeley's information, or not Dr. Keeley's, but Tobacco Free York County Coalition information on our Instagram page specifically. They have a great social media account. So if you follow us, you can, follow them as well. We share and repost a lot of their information. And I did also want to say, for any of y'all on the call who work with youth, we're promoting the annual youth conference again this year, Escape the Haze, Facts Over Fumes, and our great partners at the Orangeburg Fire Squad. That's their youth coalition in Orangeburg under their DeOtis Commission. And then the Pickens County Youth Board is the youth coalition in Pickens County. They're putting together a youth conference again this year. I will share the link in the chat. And if you work with youth, if you work with schools, if you have a great relationship, they would love it if you would share the conference information with those contacts. There's no fee to attend. Schools will just have to, help transport the kids to Columbia, but there's no admission cost or anything like that. So,
we do provide the funds to reimburse the cost of transportation. So that's needed by the district.
I put that link in the chat. So please feel free to share that. It's going to happen at the end of April in Columbia, I think April 30th. So they would love to have great attendees there. So feel free to share that as well. And that's all I have, Barbara. So that's it.
All right. Well, that's it, everybody. We really enjoyed talking to you. Have a great rest of your Friday and a great weekend.
Thank you. Same
Thank
to you.
you. Yep.
Bye
Bye,
bye.
y'all.
Bye-bye.
Bye-bye.